to be completely honest, I've been thinking about this for days. And I always hear, and I heard it when my son died, and I started speaking out about Gavin, and I made Gavin's page. So I'm going to be very, very blunt about this part, and people might not like it, but this is the truth. I always hear babies die in hospitals too. And yes, you're right. I've met a lot of families where their babies have died in hospitals. I have. And I've met a lot at birth centers and home births. I've met a lot of lost families over the years. And I'd like to point something out. I'm just going to throw this out there, and this is going to make people mad. I already know it is. Do you know why we're not improving hospitals? Do you know why we're not making the improvements that are needed? Because we're too busy having to mess around with all this midwife crap. I'm just going to throw this out there. We have too much of these midwives saying the hospitals are bad. Come with us. We're better. Come over here. They're evil kind of thing. But all it does is take away with working together for better improvements. If the midwives jumped on board and actually was like working for improvements and actually doing better and wanting to do better, we could actually have better care. Now, I say this because obviously we have nurse midwives. There is nurse midwives that do want better care, that do want to improve health, improve care, improve pregnancy, improve birth. They do want to, and they take it very serious, and they've spent a lifetime career doing this and training and passing the knowledge on, and they're awesome. And I know a few of them, and they're freaking awesome. And I'm like really glad that we bumped into each other. But then you got these other ones that they're just making money. They're not about improving care. They're not about whatever. And when you're pointing the finger at a doctor or a hospital, you're part of the problem. You're part of the problem because we should be working together as a whole. Midwives, nurses, doctors, hospitals, out of hospital, everything needs to work together. And we need to create a different system. I say this in the thing of like, yeah, we talk about choice and all this stuff. And obviously I made a decision. I made a choice of out of hospital, and I would love to have safe home births, and I would love to have safe birth center births. But the reality is there's a void that circles around midwives, even some doulas that have this natural idea that literally they don't care about if we're feeling good, if we're improving, they don't care. And I think the thing is, while you talk about hospitals and you want to throw all this stuff about hospitals, and again, years have gone by that I've been thinking about this. The reason we can't improve hospital care is because we have the other side holding us back. So you have two flips of the coin, but we're not meeting in the middle. And I feel like if we met in the middle a little bit, we could actually make some improvements and changes. There's possible ways to make some major, major changes, and we could actually work together. And I can honestly say, and this will blow people's mind. This is going to blow everybody's mind, even just throwing this out there. I have talked to CPMs in the US. Okay. I've sat down and kind of had some conversations with them. And I even, in a way, it's kind of even weird that I'm saying this because I hired a CPM and look how terrible things went. But I know a couple here in the United States that actually have to do with, they wanted midwives to be licensed, and they wanted them to be regulated. Whoa, CPMs want to be licensed and have regulations of what type of births they can do and not. Whoa, mind blown right there for me to learn this from other people that are out there. So just in case anybody wants to know, there is some out there that are the ones that are pushing for laws, that are the ones that are pushing for regulation. And I'm cool with them. We're totally cool with each other because you're pushing for improvements and safety. And that's what I want. I don't care what type of midwife you are. I don't care if you're a doula. If you're in the field that has to do with bodies, people's bodies, please take care of them. Please put safety as the number one thing of anything. Safety more than any idea of whatever, of your natural garbage. Safety needs to be number one. That's what evidence-based care means. And that's what I kept repeating over and over and over when everybody's like, you don't want midwives anymore. I want evidence-based midwives. evidence-based care, because that's how we improve. That's how we grow. And that's how all of us do so much better. And we stop having preventable deaths. That should not be a thing. That's all I want to point out, is that the reason that we can't focus on hospitals and doing better for like doctors and nurses and all this stuff and making our system even better is because we have all this crap from out of hospital stuff that we have to deal with. And unfortunately, nobody really wants to deal with it, because I already know, like listening to like the bill stuff that was going on, people don't want to deal with it because it's so much you have to do. There's so much work you have to do. You have to put your boots on and stay in it for years. And a lot of people don't want to do that. But that's the truth. That's why I just want to bring that up, because it really bothers me of the whole babies die in hospitals too. Like, how dare you? How dare you say that? And you know what? Those are still grieving parents too. Just in case you're wondering, their baby shouldn't be discredited either. Just because their baby died in a hospital and you want to use that as your example, like, no, those are grieving families too. So anyways, go on, Marissa. I know you have something to say.
Oh, no, I love what you said. And the truth is that when we're not calling anyone out, really. If you are listening to what we're saying and that description fits you and it makes you mad, you need to look at yourself and how you practice. You need to look at your philosophy. If you are practicing evidence-based care, this is not going to be a problem, and you're going to be glad someone is saying something. If you have a problem with us calling out so-called professionals who don't want to do standard testing, who want to be hands-off, that's the problem. And like you said, Danielle, we're so busy chasing these people, trying to get them to just have a standard of practice. We can't improve anything else until that's taken care of.
I definitely agree with both of you. I think the problem we always have when we say evidence-based care is mostly because the minute someone says evidence-based care, it becomes whose evidence. And there are people who will immediately say, well, I have evidence that shows blah. I mean, it's like, yeah, okay. And then you end up debating which evidence is valid and whether it ends up being, yeah, no, that's a bad study. No, that doesn't show what you say it is. And it's annoying and kind of pointless because you're not talking about the same things. I'd say in the spirit of things that I believe in evidence-based care, because I've seen the studies and dang, there's some impressive stuff out there that we could learn from and do. But I would say best care. Are we following best practices? Are we getting the best outcomes? Are we producing the best results? It's all about quality care. And the problem I have with midwives who fail to do that is they really aren't trying to create the best outcomes, because their idea of a best outcome is simply to push the natural process as far as it will go. And when it fails, they aren't terribly concerned. I mean, babies do die in hospitals. I worked in a pediatric hospital. I mean, if you want to have your heart broken, work in a pediatric hospital. It's really tough to look at families who know that their child is not going to make it for whatever reason. I remember one time I saw a woman with her little girl who had her scalp shaved, and I said, how's it going? And she just looked at me, and she didn't even say anything. She just gave me this look, and I was like, it's bad news. It's bad news. She's going to lose her daughter. And yes, but hospitals are going to take care of that patient the best they can. They will give the family all the information they can. And after they lose their child, there will be services the hospital will offer them to help them cope with the loss. And everybody should strive to do that. And if you don't, if a loss in your practice simply does not affect you very much, then I don't think you're doing it right. I think it should affect you somewhat. I think you should know that, double check yourself, make sure you did everything that you possibly could have for that family to prevent that loss and in the aftermath of that loss.
I got a new OB over like the end of last year, basically. And she wanted to know what happened with Gavin, as part of my history. And it's always hard having those conversations of like, what happened? And, you get the question of how many births have you had and how many live births have you had? And, or how many pregnancies to ask you. And so I told her what happened or whatever, and kind of try to summarize it as much as I could. And she actually said to me when she was a resident and to be an OB, she was doing her residency, she actually almost quit being a doctor. She almost quit because she couldn't handle what she was seeing midwives were doing to people. She couldn't handle it. The stuff that they were doing was so bad that she actually almost quit medicine completely. And she was like, but she had maybe some whatever kept her going. And she was like, I'm going to tell you right now, I don't work around any of them because of my experience of what I seen. She's like, I don't. And that was the first OB that I've ever had tell me that. Like, I've heard a lot of them be like, yeah, we have them in the hospital or, whatever, like it's no big deal. But for the first one to actually be like, my experience during when I'm doing residency was not good. I was kind of like, wow. And then in a weird way, I was like, well, this is why my other doctor sent me to this doctor, is because she'll understand me in a level that some doctors don't think nothing of it. And they don't really have, they won't say very much, but she was very honest, and it kind of shocked me in a way, but then it didn't shock me in a way, because I had to think she had to see things coming in like train wrecks. And then she might even know from working in the hospital of, unfortunately, we do have those, just like the one that's the nurse midwife that's like, oh, I was 3 weeks overdue. Like, they exist, they're out there. And it's a shame that that's kind of the way that it is. But I have to agree. Losses, if you're in the medical world, a loss does affect you. When we came in and we had Gavin, it hurt everyone. The staff was devastated. They never seen us before. They didn't know us. They didn't know anything about us, but it devastated them that they could not save him, that there was not enough time. And I know this because I've become friends with a couple of the nurses, and they're great people. Like, they're just such great people, and they take it very serious of their education, of their training, of updating and doing more, and being able to do more and give more. That's what they want to do. That's their life career. It's not like what we think it is. They literally want to help us. They want to improve things. They want to make things better. So I think you said it the best, Andrew, is that it's best care, because it is, you're right. It's hard to explain what evidence-based is. And that's why I was like, I'll just keep saying evidence-based, because I was like, how to explain this? It's just like, just move with the times of the evidence, where the evidence is saying like prevention. Let's go that way. But you're right. It's about best care. We should be giving the best care. We should be getting the best care. It should be best care possible that we can get. And again, if somebody doesn't know, send you to somebody else and do what you got to do. But it's interesting that we have to explain this to some people that we even kind of know. That's the worst thing about it, is like, it's some people that are in like our circles that it's like, they know what we've been saying. They know what we've been seeing over the years of how many losses we've seen and how many things have been going on. And yet we still have to explain like who we're kind of talking about, and I don't know. It's sad.